Which of the following is the most likely underlying mechanism of this patient's condition? A 62-year-old male with a history of severe burns on 40% of his body surface area is admitted to the burn unit. On day 3 of admission, he begins to experience severe epigastric pain, nausea, and vomiting. Physical examination reveals tenderness and guarding of the epigastric region. Lab studies reveal an increase in serum gastrin levels. Endoscopy is performed, which reveals a single sharply demarcated ulcer in the proximal duodenum. Which of the following is the most likely underlying mechanism for this patient's condition? Okay. So severe burn is a curling ulcer, curling iron, whatever else, curling ulcer. It's a decreased gastric blood flow, decreased gastric acid secretion. Well, we have increased gastrin, so it wouldn't be that one. Increased H. pylori infection, increased NSAID use, increased Zollinger-Ellison syndrome. I would say not increased Zollinger-Ellinger syndrome, decreased gastric blood flow. It wouldn't be increased NSAID use, I don't think. I don't think that'd be the right answer. And an increased H. pylori infection? I mean, severe burns. My gut is saying decreased gastric blood flow. I'm trying to make sure that I really disagree with increased H. pylori infection. I feel like I don't know why my whole thought is like you would just have more acetylcholine, like more like acetylcholine like stimulation of those like cells that would produce gastric acid. That's why you have increased gastrin. But I don't know here. I always feel like I get questions wrong when I lean against H. pylori, but this is what my gut is saying, so I don't know. I'll go with
Okay.
this one.
All right. Yeah, that's gonna be your best answer, right? So this is what you call a curling, right? Ulcer, right? Um, but yeah, so I think of it how do I say this? Everything needs good blood supply, right? And
Yeah.
so in this particular instance, right, you have severe burns. If you have severe burns, what happens to your overall fluid status when you have burns?
You lose it, you dehydrated, aren't you?
Yeah, you're dehydrated, right? So you're losing a lot of fluids, right, through your burns, which is why you need to keep them covered, right, moist, right, things like that. And so because of this reason, of course, you're gonna have some decreased blood flow. It's the most direct answer, right? It's really stretching it if you're like, oh, okay, so if you get burned, you get more H. pylori. That's not, that's an
That's
infection,
not
right?
it.
So that's pretty far from the question, right? And of course, decreased gastric acid secretion. We already know that's not true, right? Increase NSAID use. I mean, you can compound it for sure, right? By giving NSAIDs, right? That would be not good, right? And then I don't even know what increased Zollinger-Ellison syndrome is.
Zollinger-Ellison is the like pancreatic tumor
For
that,
sure. But I don't
yeah.
know if that means like what does it mean to increase it once you already have the
Oh,
disease, right? Like what does it mean? You can't turn it on, right? You can't turn on the disease more, right? So that doesn't make any sense, right? So best answer here is going to be decreased gastric blood flow, and that's what a lot of the time because of kind of how sick these patients are in the SICU or BICU or burn ICU here. A lot of them will be on like PPIs to decrease the gastric acid
oh
content.
yeah.